Not bad, not bad.
Yeah.
Dylan, appreciate it. Well, exercise science is a discipline that studies movement and the associated functional responses and adaptations.
That's right, and we are joined by an expert in this field, Dr. Elise Kearns. Thank you so much for coming in, Dr. Kearns.
Hi, thank you so much for having me.
Okay, and thank you for being here. So let's do this first of all. Give us an overview of what exactly is exercise science, first of all.
Sure, exercise science is a major that prepares students if they're thinking about going to graduate programs, whether that be physical therapy, occupational therapy, athletic training, some of the health professions. So it's a broad major that prepares students to do that.
Okay, very good.
Very good, yeah. And it's a little intimidating because I've always had an issue with exercise. And if you look at my high school and college transcripts, science wasn't at the top of the list either.
Right.
But you combine these two and you've got a field of study. You know, you're a professor at Asbury, so tell us a little bit about the program.
Sure, so we prepare students, like I said, for graduate programs, and often that's coursework in anatomy and physiology, but also in some of the movement-related courses like biomechanics, functional anatomy.
Okay, interesting.
So talk to us about some time-sensitive trends that are going on, health and fitness trends that you think are pertinent to everyone to know about right now.
Right, so if you think about physical therapy, you might think, oh, we only see a physical therapist after you've been injured or recovery from injury. But we actually do far more than that.
Yeah.
The American Physical Therapy Association has a movement that they call choosept.org, and that's the website that they use. And it basically is physical therapy as preventive health measures, decreasing use of prescription medications, decreasing opioid use, so mental health. So there are many more things that physical therapists are able to do other than just recovery from injury.
You know, I don't think I've ever heard that before, you know, put to me like that.
No,
you know,
exactly.
I think that's really good to know.
Right, so we're movement experts. So anything that's related to movement, quality of life, things that would impact someone's daily life that's movement related, which is where the exercise science comes in.
Right.
We're the health professionals of choice for that.
So sports obviously taking a toll on this for movement.
Sure.
Age, I'm assuming, playing a major factor here too.
Right, PTs are trained to see people through the lifespan. So we go from pediatrics to geriatrics through end of life issues even.
Wow.
So,
and what inspires you to do this type of work?
well, my clinical practice was in pediatrics, but now moving into the education, into higher education, I've been in that world for about 11 years. I just love preparing new physical therapists to go out into the world and do great things and help people in their quality of life. So that's really rewarding.
Yeah,
that's got to be rewarding too, to see these students kind of on the front end of this saying, oh, I'm not sure I can manipulate this leg or this arm this way, and then by the time they're through the course and moving on, they're practitioners in the field.
Exactly. So then at the undergraduate level, we're doing the foundational work, and then they move on to the graduate level, where they do more of the hands-on work.
And you know what? I love how you mentioned this before too. We typically don't go to a PT until we have a problem.
Right.
So, and that's exactly what I did. But you know what? I learned a lot of different exercises that I could do to prevent a certain pain from coming back. And so I've been doing those inconsistently, but trying to be consistent. And it has helped, I have to admit. And it seems so easy. And I was like, oh, this isn't doing anything. And you know, for that, I'm so thankful that you all are the professionals in this, and you know what we need to help us, you know, get our aches and pains.
Turns out consistency's a thing.
It is.
It does work.
You gotta have it, right?
So we as PTs would love to see people annually, much like you would do an annual medical checkup.
That's right.
Yeah.
Interesting. Cool. And so how do people get a hold of you? What do they need to do in order to start this process?
So I'm a professor at Asbury University, so if you had a question for me, you could find me on the website there, and I could help direct you where you might need to go.
Nice.
If a student's even just contemplating this line of work, what's your best advice to them?
Gosh, you know, I have that question almost every day from my advisees. I'm not sure if I want to do PT or OT or athletic training.
Yes.
And really, you know, all of our clinics in the city are so welcoming to students to come look and observe and watch what the day-to-day life is like. So that's usually where I start with students.
Well, it seems like a great field. It really does.
It's been very rewarding for me.
Absolutely.
And Asbury's a great place to do it.
It's a wonderful place to do it.
Well, Dr. Kearns, thank you so much for being here today. We appreciate it.
Appreciate you. Back after this. Stick around.